if you have some nerve pain or you think you have some nerve pain, and we're not talking about like peripheral neuropathy type nerve pain, we're talking about like, you know, pain going down the back of the leg, more like radiculopathy type nerve pain. If you have that and you're struggling on what to do, then this video is going to be for you. So we work with a lot of patients who have radiculopathy. They've got a mononeuropathy, which is essentially just where one nerve is the problem. So common peroneal nerve, ulnar nerve, median nerve, that type of stuff. And for the longest time, it has been difficult for us to help our patients to manage these things outside of the injections. And part of that is just because there are not a ton of good physical therapists out there who really know how to deal with nerve issues. And we also didn't really have a framework by which to help deal with these nerve issues. Now, the hydrodissections work fantastic, and that's still like my primary go-to when conservative measures have failed. However, it's still important for us to have additional things in our toolbox. And so I went to a conference recently. The conference was centered around something called Neurodynamics, which essentially is the ways in which that nerves can move and interact with different tissues, and then the pathology that can arise because of that. And so with that, I learned a ton of new techniques, a lot in the physical therapy world, because the clinical neurodynamics was started by, or not started, I should say, really pushed forward by a physical therapist. And so with that, the point of this video here is that if you think you have a nerve issue, one of the biggest things that we can do is to take pressure off of that nerve. Now, that might actually mean taking pressure off the nerve, but sometimes it might not actually mean taking pressure off the nerve. This is what I mean. When you have a sunburn, the nerves are super irritated with it. What is one of the worst things you can do with a sunburn? You keep poking at it. You poke the bear, you keep touching it, you keep running water on it, close touch it, all of these things just hypersensitize that tissue such that it is just so inflamed that now, you know, the air blowing by it aggravates it. Where, you know, you go to sleep and you don't have a lot of stuff touching it and you're not touching it. You wake up in the morning and it might feel a little bit better. That's what I mean by taking pressure off the nerve, is we want to find strategies that are going to stop poking the bear of the inflamed nerve, because the inflamed nerve does not act in the same way that an inflamed joint does. It does not act in the same way that an inflamed tendon or inflamed ligament does. These are different structures. They are different types of inflammation, even though we just all call it inflammation. And so the struggle is figuring out what you need to do to take pressure off that nerve, because sometimes we need to do nerve flossing, and there's tons of videos online about that, and you know, you can read more about it and try it out. But there's also other things like actual decompression, right? Not the spinal decompression, although that can be beneficial for some people. But as an example, if you have a pinched nerve in your neck, flexing forward and leaning away is actually going to open up the foramen on this side. And so if you do that and that gets rid of your symptoms, that's actually a position that you might want to hang out in for 2-3 minutes and then come back to neutral and then do it later in the day. Because what you do when you do that is you're stopping poking the bear. If in this position the bear is being poked in your neck or in your low back, because the foramen is a little closed down on that nerve root, then when you do this and you do this, and all of a sudden you take pressure off of that nerve root, now that nerve root can get some better blood flow, it can clear out some of its metabolic waste products, and then over time that can actually start to improve the sensitivity of the nerve. So if you think that you've got a nerve issue, start playing around, and what you're looking for is what are things you can do that can reduce or eliminate that nerve pain. And then you might want to hang out in that position for a little while and just do that a few times throughout the day, and then consistently do that for 4 to 6 weeks. This is not something that you're just going to do one thing and poof, it's all better, because magic bullets like that don't exist. So give it a try. Let me know in the comments what worked for you, and happy healing.